If you're on the fence or making the decision about possibly having your ingrown toenail removed surgically, one of the questions you might have is, what will my recovery period be like? You came across the right video. These are my 6 tips for helping your ingrown toenail removal recovery go smoothly. And who am I? My name is Dr. Tarr. I'm a board certified podiatrist in private practice here in Phoenix, Arizona. And I own this practice that I'm recording from today called Direct Podiatry Arizona in Tempe. So ingrown toenail removal is definitely one of the more common procedures that I perform as a podiatrist, and especially here at my office. So depending on which foot doctor or which podiatrist you go to, your aftercare instructions could slightly be different, but there are some key things to do to be sure that you heal quickly, because the longer that you're trying to heal, that can lead to more pain for you. Also, just not being able to do the things that you normally do, the things that you love. And then obviously too, with a new wound on your toe, that also can increase the risk of infection as well. These are my 6 tips for you today. My first tip to help your ingrown toenail removal recovery go smoothly until your doctor gives you clearance: no swimming in pools, hot tubs, whirlpools, natural bodies of water like lakes, rivers, oceans, things like that. Any body of water that is shared can be a breeding ground for bacteria, for fungus, for even viruses as well. And again, now you have an open wound on your foot that you're trying to heal. So that is a direct door into the inside of your body. And it doesn't take much for an infection to start, especially because of water. I do have a number of patients that opt to get this procedure done during the summer. Again, I'm practicing here in Phoenix, Arizona. It's effectively summer majority of the year. So people are typically always swimming, kayaking, things like that. I will remind my patients, but especially in those months where people go to pools and do other water sports a lot more, you're going to be out for the count for the next couple weeks until this is healed. So again, keep that in mind if you have a vacation planned or anything like that that you're doing around water, that either you want to do this well before you have these plans to do whatever activity it is that you're doing in water, or after you're done. My second tip for helping your ingrown toenail removal recovery go smoothly is, don't be afraid to take any pain medication. Now, again, this is a minor surgery in the grand scheme of things, but also too, everyone's pain tolerance is different. In my experience with my patients, usually the first to the third day is usually when they feel the most pain or the most discomfort. It's usually like an ache, a soreness. So if you feel like you do need it, Tylenol, acetaminophen, or ibuprofen, NSAIDs, if your stomach can handle it, is fine to take. This isn't a type of surgery that requires anything stronger than those 2 medications. But if you're having more pain than what these medications can cover, definitely talk with your doctor. That can be a sign of something deeper going on, like infection. My third tip for helping your ingrown toenail removal recovery go as smoothly as possible is not wearing shoes that are too tight, too narrow, that will press directly against your toe during your recovery period. Now, again, you have a new wound on your foot that you're trying to heal. And wearing shoes that are too tight during this time can do either one or two things. One, it can just cause you more pain than what is normal with this type of procedure, because now you have the direct pressure from your shoe pushing on this wound. It can also cause you to drain, to bleed a lot more as well. And in some people, it can actually slow down your healing process. Wounds don't like pressure on them. And the more that you're pressing against that wound on your toe, that potentially can slow down the rate that it can close, which again, wounds that stay around longer than normal, that can increase your risk of infection. You want shoes that allow your toes to move around, that give your toes enough space. Definitely nothing that's pushing directly on that area that now has to heal. My fourth tip for helping your ingrown toenail removal recovery go smoothly is to not clean your wound aggressively. Now, this can be tempting because you have this new wound on your foot. It might look kind of gnarly, especially if you've had a matrixectomy, whether it's with chemical or with laser. Sometimes that's like our first inclination, our first thing to do is just to scrub, scrub, scrub in an attempt to get it to heal faster. But that actually can slow down your healing. Your body, when there is any type of injury or damage to your skin, it will start to make new skin cells. And these skin cells are very delicate, and cleaning a wound aggressively, especially in a healthy person, can slow down that process, can actually damage the new skin cells and even the new skin that is trying to form. And then that can slow down your healing time. If you're healing properly, there's no need to aggressively clean your wound. Just ointment and a Band-Aid, Epsom salt, or leaving it open to air, depending on which phase of healing you're in, is more than enough. You really don't need anything else. And if you're concerned about how your wound is looking, that maybe it looks off, maybe you're seeing different colors than what you expect, and that's making you think that it needs to be cleaned aggressively, then book an appointment with your doctor. Because again, something deeper could be going on, like infection. My fifth tip for helping your ingrown toenail removal recovery go as smoothly as possible, kind of a segue from the fourth tip, is definitely don't use any products that are not recommended by your doctor. For wounds to heal in the body, a very specific environment is required for that to happen, and for that to happen as quickly and as healthily as possible. The longer that you have a wound on your body, that can actually change the skin and the soft tissue of that wound. And now something that would have healed in maybe a couple days or a week or 2 weeks now can take several weeks, several months, worst case scenario. A lot of people, when they have any type of wound on their body, especially something that they're looking at every day, they're tempted to use harsh soaps, cleaners, rubbing alcohol, hydrogen peroxide. And again, all these things research has shown can actually slow down your rate of healing. And also, too, in the case of rubbing alcohol, can actually damage these new skin cells and new skin that's trying to form that your body is making to heal and fill in this wound. So again, never a good idea after any surgery, any procedure, to use products that are not recommended by your doctor. If you have a question about if XYZ product can be used either before, during, or after your ingrown toenail removal is performed, please, please, please see your foot doctor. Personally, I've seen several patients, even though I went over what to use, what not to use. My aftercare protocol is pretty simple for ingrown toenail removal. Deviating from that does buy them added weeks or an infection because of using products that were not recommended, using products that irritated that wound even more, slow down the healing. My sixth tip for making your ingrown toenail removal recovery go as smoothly as possible. Again, if you have any questions, please, please, please speak to your doctor, whether it's specifically about the recovery, if it's about the procedure itself, if it's about what you can and cannot do, should not do. If you have any questions that come up during that healing time, speak with your doctor. And if your questions are not answered or they're not willing to sit down and have a conversation about what ingrown toenail removal entails, what is expected from you during the time period that you are healing, or any concerns that you have, then second opinion, definitely find another doctor. Because again, even though this is a minor procedure and a minor surgery, if things don't go right, that can lead to infection, if not worse, hospitalization, and even amputation. It's important to find a doctor that will hear your concerns, that will answer all of your questions before you move forward with any procedure. But that is it for my video. 6 tips to help your ingrown toenail removal recovery go smoothly. Like, comment, and subscribe. Feel free to hit that notification bell to be notified whenever I post a new video. Feel free to look at my ingrown toenail removal or surgery playlist as well to see other videos that I've made about ingrown toenail removal. And until next time, everyone, take care and wishing you good health. Bye.